If you've ever found yourself just, buried under a pile of articles and research trying to figure out the core facts on some complex animal health topic, it's a real challenge, more or less a marathon sometimes. So our goal today is to give you a bit of an express pass. We're taking a deep dive into Caseous Lymphadenitis, and we're focusing specifically on how it affects camelids, so llamas, alpacas, and cervids, like deer. Our mission, pretty simple, really. Cut through all that noise, give you a clear picture of this chronic, kind of tricky bacterial infection. We'll unpack what makes it tick, how it spreads, and why it's such a pain to manage. And this is all coming straight from the sources you gave us. Expect some practical insights, maybe a few surprising facts. We want to make this dense topic feel, well, digestible and hopefully interesting too. Okay, so let's start peeling back those layers. For anyone new to this or maybe just needing a quick refresh, what exactly is Caseous Lymphadenitis, fundamentally?
Right. So Caseous Lymphadenitis, or CL, people often call it CL, it's a chronic bacterial infection. The culprit is a bacterium called Corynebacterium pseudotuberculosis, and what it does primarily is cause abscesses, mostly in lymph nodes, but sometimes it gets into other organs too. Now, it's super common in sheep and goats, everyone knows that, but it's really emerging as a big issue in Camelidae, that's your camels, llamas, alpacas, and also in Cervidae, so various deer species. It's definitely on the radar there now.
Okay, so abscesses are the main thing.
Yeah.
But it's not just about one sick animal, right?
Sure.
What's the bigger picture, the ripple effect for people managing these animals?
No, absolutely. The impact goes way beyond the individual animal. It causes real economic headaches and serious animal welfare concerns too. We're talking tangible stuff like weight loss, lower productivity. Sometimes whole carcasses get condemned, damaged hides. It often leads to this chronic wasting condition, just slowly fading away. But the really tricky part, it's insidious. It often sets up a lifelong subclinical infection.
Subclinical meaning?
Yeah.
They look okay, but they're still infected.
Exactly, like a hidden time bomb in the herd. The animal might seem fine for ages, but it's carrying it, shedding it potentially, which makes it incredibly hard to stamp out once it gets into a group. It's this quiet threat that can just undermine everything.
A hidden time bomb that really paints a picture.
Yeah.
So if it can just hang out like that subclinically, what makes the actual bacteria, the Corynebacterium pseudotuberculosis, what makes it so tough, so resilient?
Well, it really is a survivor. This bacterium, C. pseudotuberculosis, it's built tough. A huge part of its strength is how incredibly hardy it is in the environment, outside the animal. I mean, it can survive for months, up to 8 months in the soil.
8 months? Wow.
Yeah, and maybe up to 2 months on things like hay or wood surfaces, what we call fomites. This ability to just linger in the environment, that's a massive reason it's so hard to control and spread so effectively.
Okay, 8 months in the soil, that's pretty persistent.
Yeah.
So if it's hanging around out there, how does it actually get into an animal to kick things off?
So the main way it spreads, direct contact, specifically with the pus, the discharge from an abscess that's ruptured. When that abscess bursts, all that thick, cheesy material gets everywhere. Contaminates the ground, the feed, water troughs, equipment.
Nasty stuff.
Yeah. And then it usually gets into another animal through any kind of break in the skin. Could be wounds from, say, shearing or ear tagging, even fighting injuries, or just, scratches from sharp stuff in the pen or pasture.
So tiny openings are enough.
Pretty much. Less common ways, maybe inhalation, especially if there are internal lung abscesses that rupture. Ingestion is possible too, and maybe even contaminated milk if the other lymph nodes are involved. So once this bacteria, C. pseudotuberculosis, gets inside the body, it actually gets picked up by the animal's own immune cells, the ones trying to fight it off. But here's the clever bit, or maybe the frustrating bit. These immune cells end up carrying the bacteria to the nearest lymph node, like a taxi service.
Wow, it hijacks the cleanup crew.
Sort of, yeah. And there are 2 key things, virulence factors, that let it survive and set up shop. First, there's something called phospholipase D, or PLD. It's an exotoxin. Think of it like, well, it damages the host cell membranes. This makes blood vessels leakier, basically helping the bacteria spread out from that initial spot.
Okay, so PLD helps it spread. What's the second thing?
The second is its external lipid coat. It's got this waxy outer layer, and that acts like a shield. It protects the bacteria from the enzymes inside those immune cells that are meant to destroy it. So it can effectively hide and survive even inside the very cells trying to kill it.
So it uses the body's transport, and then it has its own invisibility cloak almost. What does that battle inside the cells actually look like on the outside? What does it lead to?
Exactly. So this whole process, The bacteria replicating inside the immune cells, the cells dying, releasing more bacteria, it becomes this cycle. And that cycle is what eventually creates those characteristic abscesses we talked about, the pus inside.
Oh, yeah.
Typically really thick, doesn't usually smell much, and it has that classic caseous or cheese-like texture, often greenish-white. In really long-standing cases, sometimes you see layers, almost like an onion ring inside the abscess. That's from the body trying to wall it off over and over.
An onion ring.
Hmm.
Quite a description. Okay, so if you're looking after these animals, a producer or a vet, what are the signs? What should make you think, could this be CL?
Right, so you're looking for clinical signs. There are generally two main forms. The most common is the external form. This involves the lymph nodes close to the surface. Think around the head, the neck, maybe the shoulder area. These nodes get enlarged, they feel firm, and you can usually feel those distinct abscesses under the skin.
Okay, so lumps and bumps you can feel. What's the other form?
The other is the internal form. This one's more serious and often way harder to diagnose just by looking. It affects the internal lymph nodes and organs too, lungs, liver, spleen, places like that. So the signs are much more vague, non-specific. Things like chronic weight loss, the animal just isn't thriving, poor appetite, maybe a cough that won't go away, trouble breathing, just general weakness. Sometimes people compare it to thin U syndrome in a cheap, that kind of wasting away.
That sounds much harder to pin down.
It is, and beyond those two forms, you might just see general signs like an occasional fever, the animal being lethargic, not producing as well. And don't forget that incubation period can be long. We're talking potentially over 6 months in camelids before you even see signs.
6 months. Wow, that makes tracing it back really difficult. So if you suspect CL based on signs, how does a vet actually confirm it? What are the diagnostic steps?
Diagnosis usually kicks off with a good clinical exam, feeling for those enlarged lymph nodes, palpation. But to be sure, the gold standard is bacterial culture. That means taking a sample of pus from an abscess aspiration and sending it to the lab to actually grow and identify pseudotuberculosis.
So culture is key. Are there other tests? Blood tests, maybe?
Yes, serology. Blood tests like ELISA or the SHI test. These look for antibodies the animal produces against that PLD toxin we mentioned. They're really useful for screening a whole herd, getting an idea of exposure levels. But you have to be careful interpreting them. A positive result just means exposure. The animal could have been exposed, could have a subclinical infection, or it could have been vaccinated. It doesn't automatically mean active abscess-forming disease right now.
Okay, so a positive isn't a definite yes for active disease.
Right, and a negative doesn't completely rule it out either, especially if the infection is very recent.
Tricky. What about those internal abscesses? How do you check for those?
For the internal ones, imaging helps. Ultrasound or maybe X-rays can sometimes help visualize abscesses inside the chest or abdomen.
Okay, so let's say you get a definitive diagnosis. Culture comes back positive. What's the treatment plan? And why do the sources keep saying it's often unrewarding? What's the big challenge there?
Yeah, unrewarding is unfortunately often the right word. Treatment for CL is frustratingly difficult, and recurrence, the abscesses coming back, is really common. The main reason, it's that thick, fibrous capsule the body builds around the abscess. Think of it like a wall. That capsule makes it incredibly hard for antibiotics to actually get inside to where the bacteria are living.
So the body's attempt to contain it actually blocks the cure.
Pretty much, yeah. It works against the treatment. So when you do try treatment, especially for a valuable animal, one option is surgical drainage, lancing the external abscess and flushing it out, lavage, with antiseptic solutions. But you have to be incredibly careful. There's a huge risk of spilling that pus and contaminating the environment, potentially spreading the disease even more.
Right, that makes sense. What about antibiotics?
Antibiotics are sometimes tried, things like chilanthromycin or rifampin, but it often requires really long courses, and even then, because of that capsule penetration issue, they're often just not that effective on their own. Some people have tried injecting antibiotics directly into the abscess, but results are mixed. Mostly, treatment ends up being supportive care, good food, maybe pain relief. Helps the animal cope, but it rarely cures the underlying infection.
That does sound frustrating, the body fighting itself almost. So, okay, that's the general picture. But this deep dive is specifically focusing on camelids and cervids. Do things look different in llamas and alpacas or deer? Are there unique challenges there?
Yeah, there are some specific things to note. For camelids, llamas, and alpacas, CL is definitely seen as a serious and kind of emerging infectious disease, particularly in Europe and the US. In these guys, it often shows up as what's called granulomatous lymphadenitis. The abscesses can feel more like firm masses, maybe less obviously pus-filled initially. Common spots for external lumps are under the jaw, submandibular, near the ear, parotid, front of the shoulder, presappular, and front of the hind leg, prefemoral, those lymph nodes. But what's really important, especially from post-mortem studies in alpacas, is that internal lesions are found pretty frequently in the lungs, liver, kidney, lymph nodes, reinforcing that hidden internal disease aspect.
So maybe even more internal issues in camelids, potentially. What about deer and elk?
In cervids, so deer and elk, it's maybe less commonly reported overall, but when it occurs, it can still cause significant problems. Obviously, treating wild deer is basically impossible. You can't manage that. And even in farm deer, treatment is generally seen as unreliable for actually controlling it in the herd, which really just hammers home the point. For cervids especially, prevention is absolutely everything. It's the only viable strategy, really.
Okay, prevention is paramount for deer. So for someone farming deer, what are the absolute key prevention steps they should be focusing on?
For farm cervids, the number one thing is minimizing skin injuries. Any break in the skin is a potential entry point. So that means being meticulous about your facilities, making sure yards, fences, feeders, handling equipment, everything is free from sharp edges, nails sticking out, anything that could cause a cut or scrape. Good hygiene during handling is also vital, obviously. Keeping things clean helps prevent bacteria getting into those inevitable small wounds.
Makes sense. Keep the skin intact. So pulling this all together, treatment is tough, the bug is resilient. How do you actually control this disease effectively? Where should people be putting their main effort?
You've really nailed the core issue. Because treatment is so problematic, control has to lean heavily on prevention. And it needs a multi-pronged approach, not just one thing. Top of the list, biosecurity. Strong biosecurity. If you can, maintain a closed herd, don't bring new animals in. If you must bring animals in, quarantine is crucial. Rigorous quarantine, at least 2 months, and a really thorough check for any lumps or bumps before they join the main group. Think of it as border control for your farm.
Okay, biosecurity first. What else?
Hygiene. Strict hygiene management. Disinfecting equipment is huge, especially things like shearing gear. Clean it between every single animal if you can. Regular cleaning of pens, feeders, water sources to reduce that environmental load we talked about. Then herd management. If an animal does develop a draining abscess, isolate it immediately. Get it away from the others to stop contamination.
Right. Isolation is key. What about testing?
Yeah, regular testing. Using those blood tests, serology, for routine screening can help you spot those subclinical carriers early before they cause a big problem. And then the tough one, culling. Removing animals that test positive can be effective for control, but obviously it's costly and a difficult decision.
And vaccination. Is that an option?
Vaccination exists mainly for sheep and goats. For camelids, its effectiveness is variable. It might reduce how severe the disease is if they get infected, but it probably won't prevent all new infections, and it definitely won't cure animals that already have it. And a really crucial point, vaccinated animals will test positive on those blood tests, which complicates your screening program.
Ah, okay. So vaccination makes testing harder. What about for deer?
For deer, there aren't any specifically approved CL vaccines currently, so that option isn't really on the table for them. It really is like putting together a complex puzzle. You need all those pieces: biosecurity, hygiene, isolation, testing, maybe culling working together.
That's a really clear picture of the multi-layered approach needed. It really underscores how proactive you need to be. Now, this brings up another question, one I suspect is on some listeners' minds. Is there any risk to us, to humans?
That's a really important question to address. And the answer is yes, technically. Human cases are considered rare, but they do happen. Corynebacterium pseudotuberculosis is zoonotic. That means it can be transmitted from animals to people.
Okay, so who's most at risk and how does it happen?
Typically, the people most at risk are those who have a lot of close contact with infected animals through their job. So veterinarians, farmers, slaughterhouse workers. Infection in people usually happens through contact with that abscess pus, especially if the person has cuts or scrapes on their skin. The bacteria get in that way. In humans, it generally causes localized infection, often inflammation of the lymph nodes, swollen, infected glands, sometimes pus-filled, occasionally preceded by some flu-like symptoms.
So it's not common, but definitely something folks working with these animals need to be aware of and cautious about.
Absolutely. It really highlights the need for basic protective measures. Simple things, but vital. Always wear gloves when you're handling animals you suspect might have CL, or especially if you're lancing or dealing with draining abscesses. And practice really thorough hand washing afterwards. It's basic hygiene, but it's the key protection against that rare transmission.
Good advice. So as we wrap up this deep dive, the big picture is clear. Caseous lymphadenitis, especially in camelids and cervids, is a really persistent, challenging disease. Its chronic nature, the way the bacteria just survives so well in the environment, and the real limitations on effective treatment, it all adds up. Which brings us back to the main point. Prevention, rigorous biosecurity, careful management. Those are really the most powerful tools we have against CL. In a world drowning in information, really digging into a complex animal health issue like CL does, more than just protect animals or livelihoods, kind of shines a light on how interconnected everything is: animal health, the environment, even our own health. Makes you wonder, doesn't it? What other seemingly niche topics out there might actually hold much broader lessons about how we understand our world? And how could exploring those connections maybe empower you in ways you hadn't expected? Something to think about.